as well as proper ventilation and accommodation and working areas are not given in many prisons around the world, and access to personal protective equipment or testing capacity specific to COVID-19 is very challenging. These factors are aggravated by the typically weaker health profile of prison populations, including a higher prevalence of both communicable and non-communicable diseases. The atmosphere in prisons has become even more tense in many countries, further natured by anxieties, fears, and uncertainties amongst both prisoners and prison officials. Prison riots and other security incidents in around 50 countries have showcased that the importance of communicating around COVID-19 in a transparent manner and as much as possible with the active involvement of prisoners. The measures adopted in many countries have typically resulted in the further tightening of prison regimes, including the suspension of visits as well as very restricted access of it all to rehabilitation programs and other constructive activities outside of accommodation areas. Not being able to see families and children over an extended period of time has a serious impact on mental health and well-being of prisoners, including incarcerated mothers and fathers, and significantly aggravates the suffering inherent in a situation of imprisonment. Early in the pandemic, that prisons were releasing almost no one. Almost a year later, it is still true. We found that in the United States, the moderate drops in prison population in 2020 were the results of fewer admissions, not more releases. And the shockingly, most parole boards granted fewer paroles during 2020 than 2019. The results were, according as of December 2020, 19 state prison systems were still at 90% capacity or higher, and yet state prisons are filled with people with pre-existing medical conditions that put them at heightened risk of complications from COVID-19. So far, we were aware of these states' officials taking steps to reduce prison population in the face of the pandemic, such as changing state legislation, governor executive orders and accommodations, policy changes in correction departments and parole boards, court orders. Jails and prisons and prison house large numbers of people with chronic diseases and complex medical needs who are more vulnerable to COVID-19. At the beginning of the pandemic, jails cut their population by as much as 30%, helping to protect many of these people. But states and counties abandoned their efforts to keep jail populations low as the pandemic wore on. Some of the most significant actions taken by courts, jail administration, sheriffs, and prosecutors to release people during COVID-19 were similar to the prison orders. So court orders were implemented actions by jail administrators and sheriffs, prosecutor discretion, eliminating medical copays. So here in the United States, in most states, incarcerated people are expected to pay $2 to $5 copays for physician visits, medication, and testing in prisons, because incarcerated people typically earn 14 to 63 cents per hour. These charges are the equivalent of charging a free world worker $200 to $500 for a medical visit. The result is to discourage medical treatment and to put public health at risk. In 2019, some states recognized the harm in eliminating these co-pays in prisons, responding to the COVID-19 pandemic. Reducing the cost of communication. Here in the United States, most federal prisons, state prisons, and many local jails decided to drastically reduce or completely eliminate friends and family visitation to reduce the risk of COVID-19. But only a few made an effort to supplement this loss by waiving fees for phone calls and video communication. There are three notable examples, such as the Federal Bureau of Prison temporarily made phone calls and video calls free. The Shelby County in Tennessee, for example, temporarily waived fees for all phone calls and video communication. And also the California Department of Correction and Rehabilitation provided free calls on 3 days each week. However, just several weeks later, the department had scaled back its offer to 2 free calling days per month. So in conclusion, since the beginning of the pandemic, it is abundantly clear that the crowded and unsanitary conditions in prisons and jails would facilitate the rapid spread of the virus, putting incarcerated people and staff at serious risk of the coronavirus and at serious risk once the coronavirus entered facilities. Officials across the country ignored the threat for too long, perhaps imagining the confined population will be too isolated from the outside world to contract the virus. But the boundaries between life inside and surrounding communities are actually quite porous, with staff, vendors, volunteers, and visitors constantly flowing in and out of correctional facilities, not to mention the frequent turnover and transfer of incarcerated people themselves.